2.7 FM. It is one family,
one radio.
You're listening to The Gifted Goddess.
And Choma BBB, big, bold, and beautiful.
Stop it, I like it. We have a beautiful woman in the studio.
Oh,
with us.
she
We're
is
excited to talk to her. And this is Ilera Iku.
That's right.
Or as I like to call it, Ilera Iko. But Ilera Iku. Mm-hmm. What does that even mean? Ilera Iku? Like, cause I don't know.
Ilera.
What does that mean?
Yes, like in English.
Yes.
Mm-hmm. Like the good well-being of all residents of Lagos State.
Oh, no, that makes sense.
See, if you don't ask, you don't know.
You really don't.
And that voice you heard is the Assistant Divisional Coordinator, Badagry Division of Lashma. Mm-hmm. Her name is Anne Ejiofor. Hi,
right.
ma'am.
How are you doing this beautiful morning?
Good.
Fantastic.
I'm happy to be here.
Oh, she's all smiles. And we're glad that we're doing this to her. Amazing, right?
Notice how we said Lashma. Some people hear Lasma.
Lash.
What is
L-A-S-H.
the full meaning of Lashma?
Lashma is the Lagos State Health Management Agency. So it's Lash, not Lass.
Nice.
Lash. To whip. A lash.
Where do we even begin? Tell us about because I don't know that a lot of people know about Lashma and what you do for Lagos or in Lagos State. What do you do?
Okay. So Lashma is basically a health management agency. Okay. So we are in charge of the Ilera Eco Social Health Insurance Scheme. So this is we actually bridge the gap.
Okay.
In the health insurance, in a way that people can actually access medical benefits without having to bear the financial brunt of it, the burden of it. So, and as well as have their peace of mind when it comes to their health. So we have a benefit package that is well-rounded and extensive and cover, let's say, if not 85% of the medical needs of any individual. Yeah.
Okay, so, I mean, our focus on today's conversation is grassroots sensitization and door-to-door campaign. I mean, how open is Lashma to having conversations at the grassroots, and how far has a group gone to actually make this a staple in Lagos?
Okay, that's why we have the awareness campaign, and currently
Fantastic.
He's going on massively in Badagry Division.
Okay. So
basically, the awareness campaign is actually a way to bring the knowledge of the Lyrical Health Insurance Scheme to the grassroots. And this awareness campaign is definitely going to run across our Ibile divisions. That's Ikeja, Badagry, Lagos Island, Ekman, Ikorodu. And currently, like I mentioned earlier on, we started with Badagry. So we started with a flag-off event on the 11th of February, and as well as successive road shows across the Badagry division. We've been to Agbara, we've been to Ojo, we've been to Oriade, Maitu, and Maza Maza. So also this door-to-door sensitization is also a call to action to the executive order that was issued by Able Governor, His Excellency Mr. Babajide Sanwo-Olu, who out of the love for the wellness and welfare of all residents of Lagos State has made the Lyrical Health Insurance mandatory for all. So we as an agency, we are diving into the grassroots, to educate our people, especially people in Badagry. Hello.
No, we have quite a number of people that call us from Badagry. I'm going to tell you that I have a lot of people that call from Badagry on the show. Yeah, and so yes, they're really a part of this family, if I do say so myself. But go on.
Yeah, so dive into the grassroots in Badagry to educate our people on the need and importance of them subscribing to the Lyrical Health Insurance Scheme. And more importantly, the benefit they stand to enjoy when they buy into the Lyrical Standard General Plan, because that is the name of our benefit package. Okay. And we believe that this will go a long way in improving the health indices in the states. Okay. In addition to that, we definitely want this exercise to be stress-free.
Yes. That's something.
Yes, in a way that people can actually register, enroll from the comfort of their homes, their shops, their offices without stress. Hence the reason why we are going from door to door.
So I want to talk about the actual insurance plan or plans, the packages you have. Okay. Let's talk about that. What do you have in store and what age range are we looking at?
Okay. So when you come to Ilera Eco, our package is, like I said, it's called the Ilera Eco Standard Job Plan. Nobody's left behind.
Nice.
So there's no age limit. So everyone is covered. As long as you are living in Lagos State, you're working in Lagos State, you're schooling in Lagos State, we got you covered.
Okay. I mean, I know that Ilera has an app that you can have access to and do your registration and all of that.
Yes.
And we know that not a lot of people in that access, especially in Badagry,
Yes.
could be open enough or literate enough to want to do all of that.
The app thing.
What is Ilera doing about that?
Okay. So aside from the fact that we're going from door to door, we also have divisional offices and sub-divisional offices spread across the Badagry division.
Okay.
So we have a divisional office in Ojo local government secretariat. We have our sub-divisional offices in Badagry secretariat. We have one at Oriade local government. We also have another one at Ajeromi. So we have actually put these offices in strategic locations where people can actually walk into and register, make inquiries, register and enroll.
Okay.
I still want to go into the packages because I want to know what package is for which, grade of people, as it were.
Okay. So like I said, when it comes to Ilera Eco, we are leaving no one behind. Okay. Everyone is covered, from the child to the adolescent to the aged. They are all covered. So you want me to talk about our benefit package?
Oh yes, please.
Okay, all right. So our benefit package is quite extensive. So for the sake of time, I will just mention
a few.
Yes. Okay. So one, we are very huge on maternal care. Okay. A woman is pregnant.
Yes.
Right from when she conceives to when she puts to bed, whether it is through cesarean section or normal delivery, we've got you covered. You don't have to pay out of pocket for those benefits. They are covered. Even after delivery, the child is entitled to immunization care and other childhood benefits. They are covered on the insurance. Away from that, the insurance also covers access to dental care.
Okay.
Yes, so on it you
That
can,
is so good.
Because
you can-
oral health is important.
yes,
please.
oral health.
Yes,
You can
it
say that
is
again and
important.
again. Yes, you can actually go for routine dental checkup. Skin and polishing is covered. Yes,
Like-
yes.
I love it. Hello.
Yes, tooth extraction and composite filling is also covered.
Okay.
So we also do eye care. You can sign ophthalmologist on this package, for treatment of minor eye abrasion. We even do minor surgeries on eye
Wow.
without you paying for it. So the minor surgeries are, we have the cerebral surgery and the cataract surgery. So it's covered by Ilera Eco. So you see that
I'm
we
curious.
mean well.
I'm curious about pricing, and that's because
much?
insurance in Nigeria can be quite pricey.
Yeah.
But I know that this is a Lagos State arrangement, so I want people to know
How
that
affordable
it's affordable to everyone.
is it?
Yes, it's very affordable, and that is why we must celebrate our governor. So this health insurance is heavily subsidized. So with just a token of 15,000 naira for a year,
No way.
you can actually see you can actually access the dental care. You can actually
For a whole
see.
year?
Yes, you can actually access the eye care. You can run radiological investigations,
Okay.
such as the chest X-rays and others. Ultrasounds are covered.
Wow.
Annual medical screening is also covered.
Well, the phone lines are already buzzing, and I'm sure that a lot of people want to be a part of this conversation. So yes, if you want, 569000927. Hello, good morning. Hello, good morning.
Good morning.
Good morning. What is your name and where are you calling us from, please?
My name is Esther. I'm calling from VI.
Esther from VI. It's great to have you on the show, Esther. Do you have any question for Mrs. Annie Jofor, who's here with us?
Yes.
All right,
it's a
fantastic.
manager for. Does Ilera work for HMO?
For who?
For a personal HMO,
For a
like
personal.
a nuclear family. Yes. Where you have father, mother, children, and a child, and a middle one that is even pregnant. She's pregnant. Does it
Yeah.
work?
Yeah, absolutely. Absolutely. We've got you covered. We are leaving no one behind, remember.
Okay.
So aside from the individual package, we also have different packages for family, depending on the size of a family.
Good.
So we have a family of 4. For a family of 4, that's father, mother, and a maximum number of 2 children below 23. So it's just 55,000 naira for a year. So that one covers, the family package covers antenatal, the maternal care. Obviously, someone that is pregnant is not individual, just like as I am.
Exactly.
So obviously, that's the family package. So we also have for those who have larger family size, like a family of 6, father, mother, and 4 children. So that one is 80,000 naira for a year.
For an entire year. Like
so-
it's
And that's like
it's
the
blowing
whole
my
coverage of all things health
Yes,
Wow.
within the package.
within the package.
Yes, so Miss Esther, you're covered. We have a package for you, ma.
mind. Okay.
Thank
The
you
number
for
to
that.
call again is 0705-6900-927, or you can call 0802-502-7711. This is so interesting.
Well, you can also send us a WhatsApp message.
Yes.
0705-6900-927 is the WhatsApp line. I'll take that one more time. 0705-6900-927. Send us that message now, and yes, we'll get right to it. I think there's someone who's calling.
Yes, but you can check us on YouTube right now. We're live on YouTube, so join us, Super FM Lagos.
Yes.
Hello, good morning. Hello.
Ooh, okay. We lost
When
that
you
call.
call us,
Oh, drop.
turn down the volume of your radio set so we can hear you clearly and have a seamless conversation. The number again, 0705-6900-927. You were saying?
Okay, so I was going to ask how, with the sensitization, because yes, grassroots is important. How are you looking to bridge that language gap?
Okay.
Because I know that there are a lot of people that may not understand the English language, especially in that part of
Yes.
Lagos. So how are you bridging that gap?
Just before you answer the question, let's see if we can take this call. Hello, good
Okay.
morning.
Good morning.
Hi,
morning.
good morning.
My name is Lauren, calling from Ojo.
Okay, all right, talk to us. Do you have any questions for her?
Yes, I have a question.
All right, please go on.
I heard her say something about dental.
Dental.
Do they do like remove teeth and braces and the rest for the
Like dental surgery and stuff.
Removal.
Mhm.
yes.
That's a good question. Thank you for
Right.
calling.
Thank you so much.
Okay,
Yes.
that's a good question actually. So under dental care, what we covered tooth extraction, maximum 3 in a year.
Oh.
Yes, maximum 3 in a year.
Anybody that removes 3 teeth in a year, it's a lot.
Is a lot,
It's a lot.
right?
If we're going to be honest, I go to pull out
You
3.
sound like it's like every year they're supposed to be removing.
So maximum 3 in a year,
3 in a year,
as well
okay.
as composite filling.
Okay.
Yes, so we don't do braces.
Okay, we don't
That
do
makes
braces.
sense.
Yeah,
That
we
Yeah,
do
that
scaling
makes
and
sense.
So
polishing in
pricey.
addition.
Scaling and polishing. Okay, yes, like my question, bridging that language gap between, those that may not really understand the English language and making them understand a little more what Ilera is about.
Yes. So in Lashma, our staff were quite, we
Versatile.
are quite versatile. So we have people who speak Yoruba language amongst us.
Okay.
We have people who speak the Ogu language amongst us. Even Awori, if you want us to
Wow.
communicate to you in Awori, we have people who do that. So we actually lead this factor before actually launching out on this project. So that nobody will be left behind. So
I like how she said nobody will be left behind.
She keeps
No,
saying
that
that
is
to
their
remind
phrase.
you,
No, that is
nobody
their
left behind.
motto. Yeah, that's Ilera Eco. Nobody gets left behind. And the first time we
Yes.
ever had a conversation with someone from Ilera Eco, she kept saying that over and over again. And at some point, statement, we leave no one behind, right? And she goes on to say that.
Yeah.
Let's take another call. Hello, good morning.
Good evening.
Good morning.
morning.
sir. It's fine.
Where are you calling us from? What's your name?
My name is Saeed, calling from Ajegule.
Saeed, I
from-
thought you were out of this country, but go ahead with your question.
Yeah. So I want to ask a question about Lashma.
Okay.
So I had a friend who registered but misplaced the card. I want to ask, is there something
That can be done.
to get another card, or can we just go to the hospital to just tell them that, oh, we registered but we can't find the card? Is there something? That's what I thought.
Okay.
Thank you, Saeed.
All right.
And if they can help us drop a line so we can know how to reach out to them.
Yes,
Okay.
they'll do that, definitely. Thank you.
All right. Thank you so much, Said. Okay, yes.
Thank you, Mr. Said, for that important question. So I think what you meant to say is when you lose your policy number, okay, because your policy number is your identity on Ilera Yuku. So if you want to do that, all you need to do is just reach out to our customer care. So we have a customer care service that runs 24/7.
Okay.
So you can reach us on, Mr. Said, if you are there with a pen and paper, you can actually jot down this number. So you can reach us on 0800 2755 27462. 0800 2755 27462. You can also reach us on WhatsApp 8275.
Okay. One thing I wanted to ask: does Ilera Eco cover ambulance services?
Yes, for emergency cases when it comes to maternal.
Okay. Only maternal?
Yes, for now.
For now. Okay. So we're looking
It's
to
a work in
expand that.
progress.
Exactly.
Fantastic. It just clicked. I was like, okay, so if like, would you call and say, okay, no, something's happened with someone? All right. Thank you so much for that. Well, if you're just tuning in, it's Ilera Eco on Family Matters, your one family, one radio station, Super 92.7 FM. It's exactly 19 minutes past the 10 o'clock hour. Today, the 18th of March, 2025. And we have with us in the studio, Mrs. Anne Ejiofor.
She's the Assistant Divisional Coordinator, Badagry Division of LASHMA. LASH. Ma.
Let's be clear.
Not
And
last.
by the way, it's a good time to talk about where to find more information. If someone wants to call your customer care for more information that they cannot reach out to us on now, and
Yes.
social media. But before you do that, someone's calling. Hello, good morning. Hello, morning.
Can you hear us?
Yes, I can.
Oh, fantastic. Good
What's your
morning. What is your name and where are you calling us from? Hello? Oof. I
Okay,
think you
your
may need to
network
move
is-
around
yeah.
a bit. You need to move
Yeah.
around it. Well, we have a WhatsApp message. Someone says this. Tumishe from Yanokbaja says, what about child insurance? If a father who isn't married is insured with Ilera Eco, does that insurance cover his child too? If no, what's the process of registering a baby for insurance and how much? So he's unmarried, baby mama, and then there's a child involved, and he
would say
wants
that's
that.
a baby mama situation. So what do you do about that?
Okay. For that kind of situation, so either of them will have to choose who is going to register stand as a family,
Okay.
because the baby cannot stand alone
Okay, so there's no standalone
for a baby.
for a baby. or
Yeah,
so
they
you
have
have
to
to
be
come under.
represented.
Yes, the baby cannot walk himself to the hospital.
True.
Yes,
So he's asking whether if he has an insurance cover
Yes,
with
he
Ilera
can.
Eco, it will cover his
he
child.
can do. Yes, he can do for the family. Like the family we have from 2 to 4, so he can go for that.
Okay.
So what that says to me is that you have to, the father has to be the one to
Principal.
print the.
Okay.
Okay.
Then the child as a dependent.
All right. We have a phone call. Hello. Good morning. Good morning. What's your name, please?
Hello. You may need to still move around. I think it's the same
Yeah.
person that's trying to call
Yes,
us.
I think
It
so.
obviously
It sounds
sounds
the
like
same
that.
voice.
And I'm sure she has a boardroom question.
I know. But you can also send us a text or a WhatsApp message. Okay, so please, you can send us a WhatsApp message right now. The number to send a WhatsApp message to 705-6900927. Texting is also open, so you can send a
You
text
can
to.
send a text to 0903 714 2798. That's 0903 714 2718. Someone just joined on my Instagram live and asking, what are we talking about? What's the discussion? Well, we have the Assistant Divisional Coordinator, Badagry Division of LASHMA, Mrs. Anne Ejiofor in the studio, and we're talking Ilera Eco, aka Well-Being of Lagos.
Right.
And she's talking about the health insurance that they have available. Let's try this call. Hello, good morning.
Good morning.
Good
morning.
morning. What's your name?
Calling from Lagos Island.
Say that again.
Yeah?
Same person. Oh, what is your name?
Miracle calling from Lagos
Miracle.
Island.
Miracle.
All
Lord,
right,
entire Jesus.
fantastic. Miracle, it's great to have you on the show with us. So ask your question. Ask away. What do you want to know?
Okay. I wanted to ask if she said that the 15,000 is for 1 year, right?
Yes.
For a year, for an individual.
Yes.
For dental
For
care.
individual.
Mhm.
Okay.
Other benefits.
So what if there is an emergency and if something that I'm not the one, and that person be attended to? Since
No, because it's an individual care. It's only you that has your card. If it's family care, is anybody under
Everybody
the
under
family,
the family that would have
has the
that
card?
care.
okay, just
Yes.
me.
Yes.
Yes.
The 15,000 naira covers an individual.
And that 15,000 naira one is for dental care.
Not just for
And
dental care,
no, like
but
the
other
entire thing
benefits.
plus
Yeah. Oh, okay.
dental care.
Yes.
So other benefits, other health issues plus
Yes.
dental care.
Plus dental care.
Oh,
I
that's
just mentioned
great.
a few.
Oh, okay.
All right, well understood.
All right,
Thank
fantastic. Thank you
you.
so much, Miss Miracle, for calling us. Well, you can still call in. She's still here. We have 7 minutes to go.
And she wanted to give us the numbers that we can reach the customer care
Care on,
as
yes.
well as social media handles if possible.
Yes. So for our good people in Badagry who want to...
You love Badagry so much. I'm jealous.
They are my people now.
Okay.
Who would want to reach out to us. So we have divisional offices.
Okay.
So like I said earlier, like I mentioned earlier on, we have one in Ojo Secretariat.
Okay.
We have at Oriadi. We have at Badagry Secretariat. And we equally have one at Ajeromi Secretariat. So away from that, you can also reach me on this number. I will give my number. I'll also give the customer care number.
I think you should give the customer care number because
first.
everybody will call you.
That's true. So my phone will not explode. All right. So our customer care number, just like I called that for Mr. Said R, we have 0800 27 55 27 462. 0800 27 55 27 462. And we also have 0700 45 37 2356.
Okay.
Yes, that's
All right.
Lashma.
I want to take another call. Hello, good morning.
Hello, good morning. Ooh, okay, scrambled network. Well, if you don't already know this, Ilera always sends us one individual every Tuesday from 10 o'clock up until 10:30 on Family Matters. So today we're focusing on Badagry. Don't worry if it's coming to you next. Because a lot of people may be saying, oh, are they only in Badagry? No, it's a health insurance that covers the entirety of Lagos.
Yes.
So we
Ilera
usually bring different people from different divisions to actually come and speak on behalf of their division. So for everyone who's listening in VI East, TIOSA, don't worry, we're going to definitely do that. But you can go to their website and check all the info there. For different people. All right, give it to us, please.
www.lashma.com.
Okay.
www.lashma.com.
Lashma is spelled LASHMA, right?
Yes.
I see Kenneth from Lekki saying, I know you answered this question, but you answer it again just because. Good morning, ladies. I just tuned in. I love the conversation, but I want to ask, does this medical coverage also cover ambulance services in case of emergencies, please?
Okay, so just like I mentioned, for now, we only cover ambulance service for maternal cases.
For now.
Maternal cases.
Yes, from the primary health care center to...
Okay, one more question. Okay, let me take the phone call and then I'll
we'll
take the question. Hello, good morning.
Hello, good morning. Can you hear me?
Yes, we can.
Yeah, thank you very much. I want to ask a question. My name is Prince Will from Ebutemeta.
Prince Will.
Go ahead.
Okay.
All right. I want to ask, how your services are accessible to people in low-income areas?
Okay.
Like the villages,
Which is why we're here in the first place.
Grassroots. Okay.
Thank you.
All right. Thank you so much.
Thank you very much for that important question. So if I understand it correctly, for those who cannot pay at once the annual fee, like I said, we are leaving no one behind. So Lashma has currently partnered with the microfinance bank to ensure that we bridge this gap. So for those who cannot pay the annual premium, can join our cooperative. So we have our Ilera Tiwa Alausa Cooperative.
Ilera Tiwa,
Our own well-being.
Yes, exactly. 500. You can enjoy all of the benefits on monthly. Yes, you can enjoy the benefits on the standard JARA as well as the savings benefits. So you see
That's
that
two for the price of one.
I know. Wow. You get to take care of your health and then save extra money.
Yes,
so that
exactly. So
nice.
monthly. So
Zubi in Apapa has been asking, what are the requirements for Lashma? So what do I need to be capable
registered
to register?
okay. So all you need is your name.
Name.
Yes, your name, your date of birth,
Okay.
your phone number, and
Okay.
the hospital you want to choose. So you're entitled to choose your own hospital on our provider list. So
On
we do
your
not-
provider list.
Yes,
Note,
so
please. Not
on-
every
yes,
hospital.
on
be
our
the
provider list. So we do not get to choose for you.
Okay.
So you're entitled to your own preference.
That's
I like
amazing.
it. The jinx between us is too much. Okay.
Well, I mean, if you're just tuning in, you're not on time, darling. But well, you can catch this recording of this show on YouTube. All you need to do is just click on today's date and look for Ilera Iko, the conversation with Mrs. Anne Ejiofor, who is the Assistant Divisional Coordinator of Badagry Division of Lashma. And we've had the conversation about Badagry. So all the will I call them Badagrians? Is
Yes.
that what? Oh, that's what Badagrians.
Yes,
Oh,
yes.
Badagrians.
You're right. Yes.
A big shout out to you. I'm sure that you're listening attentively to all the details and all the local governments that are accessible, or all the points that you could actually get to have a conversation with any Lashma official, so that you can get enrolled, because health is absolutely important.
Yes.
Also, the beautiful thing is that you are not just staying in Badagry. You're coming, outwards this way.
Exactly.
And so we're all excited about the door-to-door. Don't forget, they're doing a door-to-door. They're trying to sensitize people, let them know that